Good afternoon, everyone. We have all lived with COVID-19 for almost 3 years. And during this time, we have realized how important it is to have robust healthcare systems, to have adequate financing for health, how important it is for us to utilize digital technologies in healthcare, as well as all other aspects of our life. And within ASEAN, how important it is to have cross-border collaborations and cooperation. In this afternoon's ministerial panel discussion, we will explore how we can strengthen these areas and going forward, post-pandemic, what our key priority areas are in order for us to respond to future public health emergencies as well as challenges. The health minister from Singapore has alluded the aging population as one of them, and we've heard from Tan Sri Subramaniam how important it is for us to future-proof our healthcare systems. Now, we are very fortunate to have a very distinguished panel this afternoon. And the panel comprises from Brunei, His Excellency Dato Seri Setia Dr. Haji Muhammad Isham bin Haji Jaafar, Minister of Health, Brunei Darussalam. From Cambodia, we have His Excellency Dr. Lo Veasnakiry, Secretary of State for Health, Cambodia. From Indonesia, we have Her Excellency Dr. Prastuti Suwondo, Special Advisor to the Minister of Health, Indonesia. From the Lao People's Democratic Republic, we have His Excellency Dr. Bun Feng Pumalasit, Minister of Health, Lao People's Democratic Republic. From Myanmar, we have His Excellency Dr. Tun, Deputy Minister of Health, Myanmar. From the Philippines, we have Her Excellency Dr. Lilibeth David, Undersecretary of Health for Health Policy and Infrastructure Development, Philippines. And last but not least, from Thailand, we have His Excellency Dr. Sopon Makton, Vice Minister for Public Health, Thailand. Now, we have to finish within an hour or so I think I'll just jump into the questions where I'd like to hear the views from the different ministries throughout the ASEAN region. Now, we know that ASEAN has been acutely affected by the COVID-19 pandemic, but at the same time, we have also seen the leapfrogging in certain aspects of healthcare, including technology adoption and digitalization. Now, for each of the ASEAN countries, it will be helpful if you can share any lessons your nation has learned or key priorities your country has set moving forward. Now, I'd like to invite the panelists who are here virtually to start the ball rolling first. And if I may, if we can start with the minister from Cambodia.
Okay, thank you. Okay. So first of all, Cambodia, we would like to extend our sincere appreciation to the Ministries of Finance and Economy, as well as Ministries of Health, Brunei, Darussalam, for hosting these forums, which provide the opportunity for the participating country to share the knowledge, lesson learned, experience, as well as the insights under the very convincing themes building resilient ASEAN. Let me share with Sensei and the gentleman for the two main points. The first, I will brief quickly on the lesson learned from the COVID-19 and the last. What are the high priority for Cambodia in the year to come? So let me move to the first point with regard to the lesson learned from the COVID-19. The COVID-19 pandemic has six perspectives and result in a greater understanding of how good health play a crucial role in the everyday activities, including learning, working, and social and economic activities. The Royal Government of Cambodia have adopted a risk-based approach to manage COVID-19 swiftly and effectively, and allow the country to return to the path of growth and development through reopening the country and also the social economic activity in November last year. The COVID-19 present the challenges to the achieving UHCs in Cambodia, but also opportunity are highlighted by the former ministers of Malaysia and also the college. From Cambodia context, I would like to highlight a number of the lessons learned. For the COVID-19 has highlighted how vulnerability in the health system can have a severe impact on health, delivery of essential, and also the social economic progress. Number two, the importance of the effective health system and the need for the whole government and the whole society respond. Number three, the synergy between the UXC and the health security and the need for resilient health system to protect life, especially those who are more vulnerable, including the poor, women and children, people with disability, the elderly, and ethnic minorities. Number four, need to maintain and extend the public health capacity, including early warning system, disease surveillance, and the network of diagnostic testing and information sharing within health and other sectors. Lastly, the vital role of the digital and information technology and innovation in response to the pandemic, especially surveillance and risk communication, and also maintain the provision of essential health services and other social support services. Let me move to the second point about what are the health priorities for Cambodia in the next coming years. The health gain in Cambodia has made possible through peace, political stability, and a sustained economic growth, leading to a rapid reduction in poverty, improved in the living standard, and also the key social determinant of health, alongside the improved access and coverage to health services and expand the social health protections. Despite this improvement, challenge both epidemiological and the health system remain ahead and require further transforming our health system organizationally and financially to fit for the future, and also to rely our vision for health, safe and healthy life for all Cambodia. In this regard, I wish to highlight high-level 4 interlinked strategic priorities, along with only a few strategic interventions. Number 1 is strengthening health security, shifting from risk to resilient health system to protect our people against infectious disease, including COVID-19 pandemic and beyond, public health threat and emergency events, while keeping our vigilance in the year to come. Through advancing the national capability for preparedness and response, enhance multi-sectoral coordination and actions at cross-border and regional and global levels, managing antimicrobial resistance, including zoonosis, and mitigation environmental-related health risks. Secondly, improve general health of the population, shifting from cure to care to prevent our people from ill health and premature death, and expose to the risk factor to disease, especially non-communities, which currently is on the rise, including mental health and aging. So refocusing on the primary health care, empowering individual and community to make the right choice that save life, stay safe, and sustain livelihood, and also addressing the broader social determinant of health. Thirdly, advancing the health system, shifting from provider-centered to people-centered health services to maintain multi-mode of care for patients along the entire care pathway through innovative healthcare service delivery, including digitally driving health promotion and prevention and the clinical reality, and advancing healthcare qualities, and also improve healthcare infrastructures. Lastly, expanding social health protection systems, shifting from targeting to universality to enable all Cambodians receive the healthcare services they need without risk of financial hardship through increasing population and service coverage and reducing out-of-pocket for healthcare and strengthening purchasing functions. In conclusion, the lesson learned from COVID-19 mean that the progress toward resilient health system will be built or advanced on the talent and capability used to manage health emergency, deliver change, and make substantial progress by international standards. Resilient and advanced health system to pandemic and public health threat, as well as disaster risk, continue to be essential for the safe and sustainable livelihood and social economic recovery. In this regard, more investment in health make economy of sense, and this can be of critical benefit to the country development as well as contribution to the regional development. Excellency.
Thank you very much, Your Excellency, Dr. Lo, for your very comprehensive response and sharing with us Cambodia's experience. Now, can I invite Her Excellency, Dr. Prastuti, to share with us the experiences of Indonesia? Dr. Prastuti, please.
Thank you. Uh, Excellencies, Minister, ladies and gentlemen, good afternoon. My name is Prastuti Suwondo and I'm speaking in response to your questions. Despite of severe impact of COVID-19, the pandemic is greatly accelerate digital transformation in Indonesia and even in the world. Limited mobility leads to more use of technology, particularly digital technology and advanced health technology. The role of technology is very important in future health services as well as for wider coverage of health services. To further improve healthcare services delivery and build national health resilience, Indonesia is carrying out healthcare service. Indonesia is carrying out health system transformation, which cover digital health transformation that aims for digitalization and implementation of health technology and biotech. Indonesia is currently undergoing digital health transformation to integrate and standardize all the health data to become interoperable to produce result in data-driven rapid response and policies that can effectively respond to any public health emergencies. Indonesia has set priorities for digital health transformation in the Blueprint for Digital Health Transformation Strategy 2024. The blueprint comprises of three key priorities. The first one is integration and development of health data. These priorities aims at a single health identity and artificial intelligence-based health data utilization to support responsive, accurate, and accountable evidence-based policy. The second is integration and development of application and system. This priority aims at integration of all health service systems and application to realize integrated, comprehensive, precise, and inclusive health services. The third one is health tech ecosystem development. This priority aims at strengthening health innovation such as health technology, biotech, telemedicine, and other innovation in an agile, good governed, and collaborative ecosystem for all stakeholders and partners in the health industries. Again, we do hope through the digitalization and more technology application, we could provide better health services to the people and its wider coverage. Thank you.
Thank you very much, Your Excellency, Dr. Prastuti. Can I next invite Your Excellency, Dr. Boon Feng from the Lao People's Democratic Republic to share with us the experiences in Laos.
Honorable Minister, Vice Minister, Professor David Koh, distinguished ladies and gentlemen, good afternoon. First of all, I would like to congratulate to the Ministry of Finance and Ministry of Health of Brunei, Darussalam, to hosting the second ASEAN Digital Public Health Conference. And gratitude, thanks for inviting me and delegates from Laopedia to participate in this important meeting. As a question by the moderators, and I would like to respond that as many countries around the world, last 2 years, Laopedia has been confronted the COVID-19 pandemic. From the pandemic, we learned that our healthcare system is not fully prepared and ready to respond such large-scale pandemic. Our challenges are not only capacity and quality of healthcare services for COVID-19 response, but also about surveillance, prevention, and response system. To overcome the challenges, the establishment of OEC in the country, which a daily meeting could be operated with the stakeholders through online during the COVID pandemic. A decision can be made quickly and on the real-time manner. So we integrated the emergency response system with the National Health Information Management System through District Health Information System version 2. We adopted and applied the HIS2 with the HIMS in 2014 and trying to upgrade, integrate sources of health-related information. By integrating the most of health-related information in the single system, allowing health policymakers to be able to follow up, monitoring and real-time receive information or situation of COVID-19 pandemic and other cases of emergency across country. However, we are not maximizing the benefit of digital health yet. There are room have to upgrade since more than half of our country are mountainous. Adaptation of artificial intelligence and digital technologies in healthcare is needed. In addition, Laopedia is located in the middle of 5 neighboring countries Therefore, Lao PDR is strongly support for regional collaboration, coordination, sharing information, and building a resilient ASEAN. To strengthening public digital health, we are developing digital health strategy from 2023 to 2027. This strategy aims to establish an effective and efficient digital health ecosystem to ensure quality health services by allowing everyone to make informed decisions about their health. I thank you very much.
Thank you very much, Your Excellency. And now, can I invite Your Excellency Dr. Etun from Myanmar to share with us your experience in Myanmar?
Thank Professor David Koh, Excellencies and colleagues. I would like to share Myanmar's experiences in technology adoption and digitalization during COVID-19 pandemic. Digital public health plays an important role in responding COVID-19 pandemic. The governments at all levels of Myanmar, local, subnational, and national, has turned to digital technologies to address the pandemic's effects and prevent further transmission. The turn to digital technologies has been supporting with timely and effective pandemic response in the country. The greatest support has been engaged in disease surveillance, timely decision-making, collaboration, and ensuring right logistics supplies. In Myanmar, taking opportunities from pandemic response, we have proudly established one of the basic building blocks of digital public health solution through the establishment of a web-based data system, Basin Information Management System, BMIS, which is the nationwide COVID-19 vaccination program in coordination with IT Department of the Ministry of Defense. The Ministry of Health has demonstrated its leadership with the deployment of BMIS, which has served as a national data system integrating all public and private sector vaccination information. This is one of the success stories of our pandemic response. We have been able to join the ASEAN portal for e-certification for COVID-19 vaccine through the prototype format agreed by ASEAN member states. Ultimately, the database will be functioning as client registry, a basic building block for developing future country digital health enterprise architecture. The digital solution has been deployed not only for the pandemic response, but also for ensuring continuous provision of healthcare services. The Ministry of Health in Myanmar has been working progressively on the establishment of digital reporting platform since the pre-COVID era. The District Health Information Software, DHIS2, has been deployed as a national reporting platform for the public health as well as hospital information system. Since the nation reporting platform is keep going in good shape, the ministry has planned to scale up the digital information with investment in establishing of essential components of digital health and enterprise architecture. An implementable enterprise architecture has been developed based on broadly adopted e-health standards and leveraging readily available digital health solutions. The digital solution will be playing important role with our effort to reshaping the healthcare delivery system toward a more resilient healthcare delivery in the post-pandemic. Use cases for expanded digital public health will be identified based on national burdens of disease and the current pandemic crisis. Based on national burdens of disease, immunization, non-communicable diseases NCD, and communicable diseases like HIV, TB, and malaria are the potential candidates for which initial investment for digital public health will be prioritized. We also foresee some challenges moving forward with the deployment of digital public health at scale. Limited digital public health experiences and lack of in-house IT experts in the ministry, and the requirements of vast investment amidst the economic hardship due to the pandemic. The key priorities in developing a framework for action plan focus on expanding digital public health in the routine public health services as well as in emergency services. Then it is also important to make sure to finance the action plan for implementation. We highly acknowledge the role of digital technology in strengthening and sustaining the healthcare system. We commit to accelerate the momentum toward digital health initiatives that were underway. Thank you.
Thank you very much, Your Excellency Dr. Etun. Now, can I invite Her Excellency Dr. Lilibeth David from the Philippines to share with us your experiences.
Excellencies, good afternoon. The Philippines congratulates Brunei Darussalam on the successful conduct of the second Digital Public Health Conference of ASEAN. The pandemic has amplified many weaknesses of health systems in the ASEAN region and globally. In the Philippines, restricted mobility during lockdowns spurred the need for telemedicine to provide remote health services and also helped address the lack of health workers. Fears of contracting the COVID-19 virus were alleviated through national call centers and chatbots providing health advice and information to the public. Patients looking for admissions to available hospitals were guided through patient navigation technologies and the referral command center. Management of COVID-19 cases, improving contact tracing and disease surveillance, and immediate submission of laboratory results was made possible by integrating information systems through a clinical information standard. Greater appreciation for upholding the privacy of patient-specific information was observed while engaging with private entities contributing to the government's COVID-19 response. The national and local governments became more vigilant in ensuring the ethical use of contact tracing data to ease travel restrictions. International threats to data sovereignty were enforced by developing key cybersecurity protocols. Indeed, digital health solutions are vital in responding to pandemics. Post COVID 19, the government dealt with COVID 19 compensation for all health workers and strengthened IT systems for vaccination efforts. The country's master facility registry enabled the supply of medicines and tracking of logistics, and later on, included identification codes for temporary vaccination sites. As the Philippines bounced back to its universal healthcare commitments, the following items are priorities. Number one, leverage the health information system by connecting deployed electronic medical record system to telemedicine services to enable primary healthcare service delivery. Number two, advocate for large-scale internet infrastructure to ensure connectivity in health facilities, since connectivity in infrastructure is beyond the mandate of the health department. Number three, augment human resources for ICT through professional IT certification training, the establishment of chief information officers in health facilities, and investments in IT projects. Number four, uphold data privacy through privacy impact assessment transparency. Thank you very much.
Thank you very much, Dr. David. Now, can I invite Your Excellency Dr. Sopon Macton from Thailand to share with us the experiences from Thailand.
Thank you. Excellencies, distinguished delegates, colleagues, ladies and gentlemen, good afternoon. First of all, on behalf of Ministry of Public Health of Thailand, I would like to thank Brunei Darussalam for organizing the second ASEAN Digital Public Health Conference. This is an important conference on the utilization of digital health technologies to advance health services for our peoples. It is my privilege to join you at this panel. The COVID-19 pandemic affects our region in all aspects. Its impact has brought inequity at the forefront of public health. To reduce this inequity, we have widely used digital health technologies to maintain essential health service provisions, especially telehealth and telemedicine. Thailand has also piloted various AI and digital technology for medical service and to facilitate access to COVID-19 vaccines. A number of health applications have been developed and widely used since then to increase people's health literacy and access to healthcare service. The important lessons we have learned from the COVID pandemic is the importance of resilient health system, and we can leverage digital health technology to build back better our health system and health security of our people. Thailand gives the priority of 4 areas in the next 5 years. First, strengthening primary health care. Primary health care is a comprehensive system of essential health care that is focused on preventing illness and promoting health. We will enhance the quality of primary health care service at the community level using digital technologies. At this level, we have more than 1 million village health volunteers nationwide to assist with disease prevention and health promotion activities, which are the cornerstone of primary health care. Second, strengthening universal health coverage. Our universal health coverage scheme has also been proven to save lives amid the COVID crisis. This scheme covers all essential health and medical service. We have set an ambitious plan to establish universal telemedicine coverage (UTSC) to cover every people on the Thai soil. It will start with 20 provinces and marginalized people in 2023. UTSC will include universal access to telemedicine service, universal exchange of health information as well. People will be able to access to their medical records. Third, promoting an innovative development of Thai traditional and alternative medicines. The Thai government has integrated Thai traditional and alternative medicine into USC scheme and aim to promote these medicines to treat chronic conditions and COVID patients with mild symptoms. And lastly, promoting health and wellness service. Thailand has been widely recognized as the destination of high-quality medical service for medical tourists. We are proud of being this destination and are willing to offer more health and wellness service, including the use of local produce, high-quality health products, Thai massage, and spa treatments to foreign medical and health tourists. These products and service will create more jobs for Thai people and now become a creative industry. Thank you.
Thank you very much, Dr. Sopon. And now we have the pleasure of hearing from Dato Isham from Brunei. Dato Isham, the floor is yours.
Thank you very much, Professor Koh. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and everybody good afternoon. Excellencies, ladies and gentlemen. As most of my colleagues have mentioned throughout ASEAN, COVID-19 has sort of leapfrogged the digital transformation in most countries. And Brunei is interesting because with the leadership of His Majesty, digitization of our electronic medical records have begun as early as 2012. So from 2012, we have a complete one patient, one record for the whole country. And with this experience, and when COVID happens, when we want to involve in digitization of this public health concern, that's why Dr. Ramin said it's quite relatively easy, because people understood what it entails. And from there, we go from a simple contact tracing, and into managing people entry in and out, from the color coding of the infectious disease state, and going to work and opening the business and things like that. So the adaptation of the Brew Health was amazing in such a way that almost more than 95% of the country adopts it. So with this in hand, we able to relatively control the COVID-19 spread relatively quicker as compared to other countries. But what's more important is that beyond COVID-19, like what my colleague mentioned this morning, is that how the country can invest appropriately in certain sector. So with more than 10 years of data in hand already, with the digitization of electronic medical records, what we call BRUHIM, and with the artificial intelligence what we have with EVIT, we can have better understanding of public healthcare in future. So we go beyond infectious disease, but we want to go now what we call public health precision. So what we need to prepare 10, 20 years down the line, what kind of diseases that we need to be prepared of. So for example, if we need from the data, say more renal failure going to be, so we need to prepare more renal dialysis, renal physician, etc. So it's exciting, and because from this, the investment is to ensure whatever we spend here is a saving in 10, 20 years' time. And not only from ministry point of view in terms of saving or minding your budget, it's also about empowering the patient and the public. Okay, with this Brew Health, patient can assess their data, their medical illness, their medications, okay, their appointments. They can alter their appointments, and it's in certain sectors they can start dealing with telemedicine as well. Okay, so what we envisage is that non-communicable disease still going to be the mainstay, and what we've known is that health literacy is quite low. So with this kind of digitization or digitalization of information, we want to nudge public to behave appropriately. Yeah? So we have some instances on diabetes control now. We have some program where we help to nudge with the wearables we gave out to them. So it'll remind them to do certain things. Yeah? And this will help us to hopefully prevent the end organ damage of NCDs, because that's the most expensive care. Yeah, and as my colleague earlier on mentioned from Singapore, and what Tan Sri's mentioned, preventive medicine is the key. Yeah? With the help of primary healthcare physicians, and with the help of this digitalization, we can ensure healthcare is sustainable. You know, with the increasing age, aging is another concern. Yeah. So with this kind of nudges in the digitization, we can help to prevent most of this, hopefully the end organ damage, or at least prolong their healthiness until to such an end. And not only that, some of the nudges that I've mentioned is also like physical activity. With the BN on the move, where we want to reach 20 billion step by December. We're halfway there. So it's kind of whole of nations' ambitions and togetherness to achieve this. So there's a kind of excitement for the whole country. So make sure we reach this. Because initially we asked for 1 billion step for 1 month. But with the whole of nations together, we're able to reach it within 8 days. So that's quite interesting. So that's why we challenge ourselves to at least 20 billion steps now by the end of the year. So overall, I think digitalization, not only just for infectious disease, but it helps any ministry to foresee or to forecast what's going to happen through this, what we call this precision public health, and to make sure whatever we plan is sustainable. Yeah, in short.
Yeah, thank you very much, Dato Isham. I think we've heard from the various countries in ASEAN, and listening to the various ministers and experts, I get a sense of some common themes and recurrent threads. I think one thing that we all appreciate is this huge impact this pandemic has had on all of us. It doesn't only impact patients in terms of the infectious disease itself, but also the mental health of the patients and their families. It impacts healthcare systems, it strains healthcare systems, and for the country itself, the pandemic has stretched the fabric of society in terms of its socioeconomic status and so on. But in spite of all these adversities, there are also silver linings. So this pandemic has forced us to embrace digital technologies with even faster speed, and that has catalyzed our responses. And we realize that these digital technologies are not only applicable for infectious diseases and pandemics, not only for contact tracing, but going forward, we can use it to empower patients, increase health literacy. Health ministries, countries can utilize the big data that's collected to project trends and plan for future needs of the countries. So these are positive developments. But yet at the same time, hearing from some of the panelists, we have to be aware of issues such as integration, interoperability issues, cybersecurity, and how we handle the sensitive personal individual data. I think the third major take-home message I got from listening to all of you was that it is important that we continue to pay attention to our healthcare systems. We need to strengthen the systems. Primary healthcare is certainly very important, universal health coverage. And we also need to plan to have early warning systems. Surveillance is important, not only for acute infectious diseases, but also surveillance for a longer term to anticipate what our future threats, what our future needs are. And I think the last important thing I got from planning ahead is this very important message of not only spending for the present, but also in investing for the long term in healthcare. And this is something we've heard so eloquently described in the fireside chat earlier this afternoon. And I think all of us should take this to heart. If we invest more in the right technologies, the right priorities in healthcare, in the long run, we can save money, but more importantly, our population, our people will benefit. So these are very, very important take-home messages distilled from the wisdom of all the panelists. Now I think time is really catching up on us. We have about 5 minutes left in this panel discussion. So in the last 5 minutes, perhaps I'd like to invite all the panelists to just give a quick, maybe 1 or 2 sentence wrap up, or whether they have any views on this topic. So again, can I start with the minister from Cambodia, Dr. Lo? Would you have any 1 or 2 sentences you'd like to share with us? Invite anyone else in the panel, Dr. Prastuti from Indonesia. Would you have a few words to wrap up this session?
Yeah, thank you. Thank you, Professor Koh. Yeah, listening to sharing from all the Asian countries, I think we experience the same we had the same experience, and I think COVID-19 bring us a new chance, yeah, to improve. And I think we are the same, strengthening primary care is our priorities in the future. And with the technology, with the digitalization, I think we want to ensure that uh, the we reach the patients, we reach the communities at the earliest possible, and do some screenings to invest on the primary care to ensure that they aware, educate them at the earliest possible, and also give a strong educations to maintain their health status. Thank you.
Dr. Prastuti. Your Excellency, Dr. Bun Feng from Laos, would you have any few words to wrap up the session?
Thank you, Professor David Koh. As our experience from COVID-19 pandemic, we learned that no one alone country in the world can overcome or control the pandemic. It needs country, regional, and global collaboration. And to improve ASEAN resilience against future pandemic, we have to strengthen and boost cooperation, the existing network system. As Lao PDI is a member of Lan Sang Mekong and APT Net, and we can continue to support this network. In addition, ASEAN country helps to share information and collaboration in responding any future pandemic or health threat. We should have source and supporting system to ensure every member state equally access to fund, vaccine, drug, pharmaceutical products, including AI and digital technologies. Thank you.
Thank you very much. Well said. No one country can manage this pandemic on its own. We need to work very closely with each other. From Myanmar, Your Excellency, Dr. Etun, would you like to say one or two sentences to wrap up the session?
Thank you. The regional collaboration and coordination is important in responding to disease outbreak and public health emergency. So existing information sharing network among the ASEAN member states must be strengthened. Synchronized reporting form and format and sharing information through the specific electronic platform are crucial and should be adopted. Existing mechanism of information sharing in the ASEAN region is better to review through the multi-stakeholder participatory approach, and then it must be strengthened by capacity building of public health professional, border control agency, and authority. Thank you.
Thank you very much, Dr. Etun. So information sharing, again, is a key priority for us going forward. From the Philippines, Dr. David, would you have any closing remarks?
In universal health care and health system strengthening, there is a great need here for digital health integration, and the health sector needs the support and partnership of national agencies for communication technologies. Decision-making and policy directions will benefit considerably from technology and using real-time data. The critical part here is the accuracy of the data being transmitted from the field to the analysts and then to the leaders of government. There must be a balance between speed and accuracy. The information must be timely, but it is equally important that information is correct. Thank you very much.
Thank you very much, Dr. David. From Thailand, Dr. Sopon, would you have any few words to share with us?
We have learned from COVID-19 pandemic that no one is safe until everyone is safe. In this regard, our cross-border collaboration and coordination of public health at all levels are important than never before. And in ASEAN, for response to COVID and other infectious communicable disease, including establishment of ASEAN Center for Public Health Emergency and Emerging Disease, or ACFIS. I think that ACFIS is a regional excellence and resource hub to support ASEAN to strengthening the regional capability to prepare for detect and respond to any future health threat. Thank you.
Thank you very much. And now, Dato Isham, the floor is yours.
Thank you, Professor Koh. So I'd just like to echo what my colleague said. I think the COVID-19 has taught us that sharing of information is very vital. And then what has been mentioned, especially the AFHET, the ASEAN Public Health Emergency for Emerging Diseases platform is there. So it's up to ASEAN to work on this and make sure surveillance and response is built on this platform and to ensure that no country is left behind. Yeah, that's all. Okay.
So thank you, Dato Isham. Well said. I think this pandemic, another positive outcome is that it has made us work closely, even closer together. And looking forward, I think we have to rely on each other. We have to collaborate. We have to cooperate. And as so eloquently put by His Excellency earlier, no one is safe until everyone is safe. So with that, I'd like to conclude this ministerial panel discussion. Thank you, everyone from the various ASEAN countries for joining us, sharing your wisdom, and thank you, the audience.